Hi, Alex. Welcome.
Hey, how are you?
Hey, Shohini. Welcome. Okay, I think we're ready to start. So, hello everyone. Thank you so much for joining the first edition of Lightit's and DHI's first roundtable. It's a pleasure to have you all. And today we're going to discuss how to design, build, and scale mental health products. This roundtable was organized by Lightit and DHI. Lightit is a software development agency that specializes in building software products for healthcare organizations and startups. And DHI is a healthcare newsletter that delivers weekly insights on the industry, offering a curated list of the week's top 10 news. So we're gonna divide this roundtable in 4 modules. We're gonna start with the context of digital mental health. Then we're going to discuss how to build mental health products. Then we're going to talk about how to scale them. And lastly, we're going to spend 5 minutes answering to questions. So if anyone has a question, make sure you leave it on the chat. Okay, before we start, we're gonna present each other. My name is Alan. I'm gonna be the moderator today. I'm the founder and CEO at Lightit, and I'm a digital health innovator. So now it's time to present the rest of the speakers. Philippe, do you want to start?
Sure, yeah. Thanks, Lightit, for inviting me. So I'm Philippe Cailloux. I'm a product designer and entrepreneur, and I'm happy to share my experience in developing patient engagement solutions with you today. And I'm currently incubating my next company.
Thank you, Philippe. Alex?
Hi, everyone. I'm Alex Stried. I'm the CPO at Cerebral. Cerebral is a telehealth company focused on mental health. Prior to Cerebral, I was the CPO at Elevest, which is a financial company for women. And then I have also held senior product leadership roles at Weight Watchers, which is designed to help folks achieve a healthy lifestyle. So thank you for having me. I'm glad to be here.
It's a pleasure. Mohsen.
Thanks, Alan, for having me. My name is Mohsen Omrani. I'm a co-founder and CEO of Opt Health. Opt is a B2B SaaS digital mental health platform targeting healthcare organizations to increase their care capacity by up to 4 times and lower the cost by up to 10 times. We equip clinicians, with clinically validated content and AI capabilities to facilitate evidence-based decision-making.
Thanks. Shohini? You're muted. Okay, let's move to Emilio meanwhile.
All right. Hey, Alan. Hey, everyone. Thanks for the invitation. My name is Emilio Goldenhersch. I'm co-founder and CEO of MindCotine. MindCotine is a virtual reality, behavioral health, and mental health company scaling one-on-one therapy with clinically validated mental health programs.
Awesome. Evans?
Hey everyone, Evan's Rochaste. I'm the founder and CEO of ReKlame Health, also a board certified nurse practitioner in training. So ReKlame Health for behavioral health and addiction medicine startup. Our platform essentially helps young adults, people of color who are suffering with behavioral health and addiction medicine challenges, take back control of their lives by providing them with culturally competent medication management providers.
Thanks, Evans. Shohini, are you there? We're having some technical problems. Okay, let's start with talking about the context of digital mental health. So according to Nature journal, the diagnosis of depression and anxiety keep rising year after year, mostly among teens and young adults. Evans, why do you think this happens?
Yeah, that's a really good question. A couple of reasons. One, post-pandemic anxiety and stress is a thing, especially among young adults. If we think during the pandemic, young adults went through really challenging times where they were used to socializing and then immediately, almost overnight, right, they stopped socializing. So as humans, social connection is really important. So the increasing of loneliness, isolation is really what is leading to increasing in depression and anxiety. Also, there's a lot more pressure now, right? When you think of academic performance and what we expect from young adults, and that pressure that's being placed on them from society is also increasing day by day. You combine that with other stuff in the ecosystem, such as the macro environment, social media, and other vulnerabilities that a young adult can have, such as a family member who may have anxiety and depression. It's becoming increasingly hard for young adults to navigate society with the challenges that are being thrown at them. So that's from a clinical standpoint, that's what we're seeing in terms of why these increasing in diagnosis is happening.
Absolutely. Mohsen, do you have anything to add?
Oh, I think it was mentioned most of them. The only thing is that it seems that, our education is not, moving at the same speed as our technology, right? It's like the same thing is a similar situation we are talking about right now in the AI space, like, with all the ChatGPT and what it could do, and we don't still have any regulations. The same thing happened, for instance, for the teens. They came into a digital age without having enough resources. And to be fair, I mean, there was not enough resources even before that, right? So mental health is a scarce resource in many places. I don't want to repeat all the statistics that everybody knows, but I think that lack of education and resources are what actually causing this.
Yeah, and you mentioned technology. Evans mentioned social media, and it seems like many people attribute the rise in mental health problems, mostly among the young, to the extensive use of technology. So my question is, can we leverage technology to create the opposite effect? How can we do it, Alex?
Yeah, of course. Well, there are product teams who are working with, their clinicians and their researchers on developing and testing apps, from everything around, managing medication, teaching coping skills, predicting when, someone may need emotional help, which is actually something that, Cerebral does. We're able to, we have a crisis management detection program where, someone writes in and says that they need help, or, they want to hurt themselves. We have a NLP, a natural language processing model, to predict, when someone may need to be, reached out to. And, we can get to someone in, less than 90 seconds. And so I think you're starting to see more of this pop up in the space, using technology for good to help people through, all of their health needs.
Yeah. Shohini, is it working for you now?
Yeah, sorry about that. My Zoom client was not working.
There are always technical problems. Yeah, that's natural. Do you want to very briefly introduce yourself, and do you have anything to add to this question?
Yeah, so sorry about that. I'm Shohini. I work on our platform product at Firsthand. Firsthand provides peer support services for individuals with severe mental illness, such as bipolar and schizophrenia, who are covered by Medicare or Medicaid, and often both with decent folks. We are very much ultimately a services business, relying on our certified peer recovery specialists who have lived experience with SMI to kind of connect with individuals and get them connected to healthcare services, social services, utilities applications. It's a very manual, very manual work in the end. From a tech perspective, what we do is we're building the platform for our colleagues to be able to actually do this work consistently and at scale. And we're moving towards like a value-based care model. No, I don't really have something to add on this specifically. I think it just, yeah, so go ahead. I think we can go.
Okay, so is the platform you're building a telehealth platform, or is it just to coordinate?
It's like internal, it's an internal platform. So we actually don't build any patient-facing tools. In the end, we really believe like the human connection of the peers and their lived experience is what really makes us different, and why we have engagement rates that are, double, triple what the industry is seeing, especially for these folks. And we are building, it's the closest thing to compare it to would be some kind of like case management or CRM software. But we're really thinking about, hey, how do we make it mobile first? How do we make it so that, a lot of our peers and colleagues are not really used to working desk jobs. So they're not typing at 100 words per minute. What does it look like to have to capture the information and the data that we really need to run our company at scale, while being friendly to the fact that like people might have their own mental health diagnoses. They may not be used to spending time or can't spend time in front of the computer for extended periods of time. What does that look like? And so we're really building a kind of task management CRM type platform with that in mind.
Right. So now that we briefly spoke about telehealth, so there's a recent report by McKinsey that says that there's a 38x increase in the use of telehealth platforms compared to the pre-COVID baseline. So I wonder, why are people still sticking to telehealth, and what benefits does it bring specifically to mental health? Evans, what's your take on this?
A couple. One is, so telehealth, one thing it does is it overcomes the geographic barriers, right? When we think of care deserts, such as like if we broke apart New York, we have New York City, but there's the entire upstate New York that no one thinks about. If you're in one of these care deserts and you're looking for a provider that looks like you, or a provider that specializes in substance use and abuse, it can be extremely challenging to find those providers to be able to provide that care. It offers greater flexibility, convenient, when you think about childcare, students, being able to be home at 5 p.m. versus be on the train and trying to rush home or rush to an appointment because the office has limited hours, that can be associated with just better outcomes, more engagement. The final thing is, I always like to tell people 50% of my job is trying to reduce stigma. So sometimes telehealth helps someone start their journey sooner than in person, right? And think about in person, going to the office, sitting down, traveling. And if you have such a diagnosis such as generalized anxiety disorder, where the diagnosis is feeling on edge, doing something in the comfort of your own home may be the difference between starting a journey 6 months sooner.
Right, but there's still some benefits from in-person treatment, right? Like specifically for mental health, it feels more personal, feels more human, it's more engaging. Can we leverage emerging technologies like VR and AI to get the best of both worlds. Emilio, I know you're working with the AI for your platform, so maybe you have something to add to this question.
Well, I will talk a little bit more about the VR, the virtual reality component. But yeah, I think myself as a psychologist, I've been working on a clinical settings with a one-on-one, but then when moving into the VR, I think that it's a technology that allows the recreation and the simulation of environments. And from my perspective, I think that we are surrounded with an environment that sometimes with just telehealth, like two-dimensional technology, is not as easy as to transport the person into that setting. So if we are training somebody on stress management or anxiety or social anxiety or a substance use disorder, and then we need them to understand what's going on and what their feelings are in that specific situation, virtual reality can actually emulate that situation, takes that person closer, really to feel that they are in that situation, and control the environment, control the cues. So any kind of triggering that it happens there, it's in a more controlled environment. And I think that's unique to a technology such as virtual reality. I don't think it's going to be, as the same as powerful as could be in person, because usually, and also in my experience, having a one-on-one interaction is at the end of the day what makes us human. But the virtual reality, by leveraging these simulations, is something that can really get us closer.
Absolutely. And does anyone want to comment on the AI part?
Yeah, I can say a word on this. I'm a very strong believer in the bond that develops between the human, the provider, and the clients. And I think that there's a great opportunity in between visits where there's a big gap in this presence, or the bond is broken or is distant. So I can totally see AI as being used and productized in extending this bond outside of the sessions, outside of the sessions, and could be like training wheels of some sort when you have to go and do your homework, or you have to read a book today, or doing some exercises. So a lot of supporting applications to support the programs that have been developed and between the patient and the provider.
Absolutely. Yeah. And Mohsen, you're strongly leveraging AI in your platform. What's your take on this?
You're mute.
Oh my God, after 3 years, you would think we already know. So I strongly agree with all these sentiments. I think there is a necessity for the humans to be in touch, but it doesn't mean that the human should do everything. There are lots of tools that we use to increase their productivity. Like what we see, for instance, using, we have this supervised digital CBT. That on average, like patients complete 8 sessions. And as much as we want to take credit for our modules to be very good, we believe it's because the fact that there is always a clinician providing feedback, and the patients feel accountable that, okay, there is somebody else sitting there, that is listening to what I'm saying. But that doesn't mean that we cannot make it easy for the clinician. So for instance, what we do is that we use natural language processing for a bunch of clinical decision support algorithms. There are stuff that the algorithm can do that maybe a clinician who has like 20 years of experience would be able to do. Like for instance, we can predict patient dropout by 70% accuracy 4 weeks in advance of them dropping out. Right? Again, this is something that a clinician who has worked like 20 years has the intuition. They can tell you. They might not be able to tell you why, but they can tell you, okay, this person is probably not going to complete. But this is the kind of stuff that we can collect using the AI. We can use that to incorporate that intuition into something, formulated. That somebody who has, come out of the school yesterday can also have access to this kind of insights that, a 20-year experience, a clinician can have. So there are a lot of ways that the AI can help with this.
Thank you, Mohsen. Okay, let's start with module 2. Let's discuss how to build mental health products. So most telehealth solutions, they have two types of users. There's the patient and there's the provider, but still most of the solutions focus on the patient experience, leaving the provider aside. So this is a question for Alex. How can we build a comprehensive solution for both parties, and why is it important?
Yeah, so I'll first start off by saying, we need to treat our providers as customers, right? We need to make sure that they have tools that are easy to use and are friendly. You want to make sure that the jobs that they're doing outside of their sessions with their patients are, as easy as can be. And whether that's, tracking payroll or, taking notes about a session, you really want to streamline those experiences for them. And mainly because if you have disgruntled providers, that comes out in the sessions, right? If you have a clinician who's, oh gosh, this error again, or this is happening, it goes on to the patient, right? And you don't want that to happen. You want that experience to be all about the patient and nothing else. And so we keep that in mind as we are, building products for the providers. The other thing I will say is that we collect so much information, after the sessions, that we want to make sure that we are using that information in a valuable way and providing it back to the client. And so if the provider is taking notes, we want to make sure that we are finding ways to streamline and do that so that we can, maybe provide the client with next steps and like things that they're supposed to do outside of the session, right? Session happens once a week, but, you're dealing with, your mental health 24/7. And so making sure that, we're using the tools that we, the data that we collect in the EMR and passing it on to the client. So treating it holistically.
Thanks. So this is going to be a tricky question. So to maximize the efficiency of treatments, approaches should be evidence-based and clinically rigorous. How can we leverage technology to facilitate this, Mohsen?
Yeah, so it's a two-way street. First of all, I want to make sure that when we are designing a technology, we should always look into the clinical validation. And it's important to remember that mental health is health. And the same way that we do not expect somebody coming, waking up in the morning and say, oh, I came up with a new way to do heart transplant. We shouldn't expect something like that from, mental health app either. What you are designing should be validated. It should go through a very rigorous, trial to make sure that, first, you're not doing any harm. Second, you're actually improving the mental health, right? But on the other side, it's the same thing is true, on helping, clinical validation. The challenge with mental health is that a lot of mental health is stuck in like 7 years ago. I mean, it's mostly the biggest, advancement has been what I've been call it from room to Zoom, right? We do exactly what we did in person now through, Zoom, right? That's not really the progress. The progress needs to be in different ways of collecting the data, engaging the patients, so there are all different ways of making sure that, if we are treating patients, we are using the technology in a way that increase the access, increase the engagement, and improves the outcomes. And as I said, like, for instance, before, if you go to a doctor, they want to ask about depression, they ask you, how have your appetite been? How have your, have you been sleeping? How have your activity been? Now, instead of just relying on some sort of, qualitative explanation from the patients, we have tools that we can evaluate that. We have tools that we can exactly look at the patient's pattern of sleep or pattern of activity, which could be really important in situations that, for, understanding the relapse, for instance. So, I mean, there is no question that we need to incorporate as many technologies as possible to improve the quality of care as it's been done through the rest of the medicine.
Yeah, and another aspect which is very important for mental health, besides it being evidence-based, is the empathy in the relationship between the patient and the provider. So what are the challenges of creating this empathy in underserved populations? And what product decisions can we take to help them heal and thrive? Evans or Shohini, what's your take on this?
Repeat your question. It's how do you generate empathy between providers and
Yeah. Mostly when working with underserved populations.
Yeah, I mean, the secret to our success has definitely been that we are employing a lot of people who have lived experience. Like, there's honestly not really great ways to understand what someone has been through without having gone through it yourself. And we find that, like, often peer recovery specialists, people who have mental, like serious mental illness, whether it's bipolar or schizophrenia, may not actually even find employment in other places, but them actually having that lived experience is a superpower. From a company perspective, we obviously have to, like, figure out how we staff with that in mind, give more leeway. We have a lot of mental health benefits as a company. Like, our head of people has put in a ton of effort into thinking about how do you support a workforce that might have more diverse needs in that way. But yeah, like, it's both employing people who have that lived experience rather than assuming that what that feels like. We get so much amazing feedback from our peers about how we should also design tools for their work, given their conditions, or given their kind of edge in the work that they do. And so we take that into we do a ton of product feedback internally to make sure that we're actually servicing them in the way that they need.
That's really amazing. And Evans, how do you achieve this in ReKlame?
Yeah, so lived experience is definitely key. So the other aspect I'll touch on is, I would like to say, like, what's going on right now is such a small part of someone's experience in the mental health system. So especially with underrepresented populations, there's so many cultural, social, economic challenges that they're experiencing. So being able to provide that support outside of the session, and it could be whether the company takes that part of the care delivery on themselves, or works with sort of a company like First Hand to wrap around, especially for underrepresented communities. It's really important. If I don't know where I'm going to get my next dollar from, I'm not going to be able to come to a mental health session, right? Another aspect of it is really culturally competency. Having providers that look like the population that they're serving is also really important. So combining those two aspects is how we've been able to see the greatest success.
Right. How is building a healthcare product different from building a product for other industries? Are there any UX considerations or strategies that are specific to mental health? Philippe, what do you think?
Yeah, there are definitely fundamental differences. I think that everything that the panel has been discussing right now is I find right on when it comes to the specifics of the healthcare business. What I'm going to mention is a high-level approach if you are not in the healthcare industry and you're planning to build something. So let's take an example and imagine that you're part of a startup to create a PTSD management product for providers and their clients. So I'm going to highlight 5 potential project killers for that. The first is the team, what I call the team challenge. So picture this, right? A first-time clinician CEO, a low empathy engineer, a big pharma business person, and a product leader lacking human psychology and cross-cultural skills. That's game over before you even have a chance to start. The second is the user research challenge. Healthcare is not very friendly when it comes to iterative development. So it's very essential to inform the development with the patients and the providers' insights. And you talked about SDOH, about cultural differences. This is super important. And by the way, it's very hard to do in healthcare, very hard to access patients and providers, especially at the same time. And the worst trap would be to think that clinical expertise can replace user research. It just doesn't work. The third one is the regulatory challenge. There's a very fine line between a regulated and a non-regulated product, especially with the moving target from the COVID exceptions that ends in November and whatnot. So if you don't pay attention, the project will become very long and very expensive very quickly. I also found HIPAA is a trap because many providers have, in fact, implemented stricter policies than HIPAA. So you think we're good, you look at HIPAA, you think you're good, you go, but the provider say, oh, no, I'm not going to do this. The fourth is the adoption challenge. So even after you have a successful pilot, and I totally agree that it needs to be validated, safety and efficacy. So you have a successful pilot. Well, getting the providers to adopt a new tool is just not easy. And for the patients, actually, to stick to a digital solution can be harder than simply taking medication. Even if you have like a clever incentive mechanism in place, can't beat the pill. And the last one is the revenue challenge. So you went through all of this. Now you have your product. Who's going to pay for it? It's very different from the other industries. The patients, the providers, the payers, and actually none of them are willing to put their credit cards number on the table. So to overcome these differences, healthcare-specific challenges, 3 things: a strong interdisciplinary collaboration, an empathy-driven design process, and a strong understanding of the clinical and regulatory landscape, which all of you on the panel, I know you have. Thanks.
Yeah, it's definitely way challenging to build products in this space than in other industries. There are a lot of particularities. This is a very broad question. If any of the speakers want to add to this, feel free.
Yeah, just one quick point that like we've noticed, we have a large payer client. Their data use agreements are much stricter than even your standard HIPAA compliance. So we and others might have things like you can't have data that's sitting outside of US borders. We don't have that particular requirement, but we have all worked at other healthcare companies where that's been the case. So even using vendors to build your own products can sometimes be like a pretty difficult and lengthy process. Very few vendors will want to sign BAAs where you will get subject to audit at your own cost. Like we have clauses like that because of our clients. So it kind of forces us to rebuild a lot of things that ideally would exist other places. And that's often why you'll see like pretty big raises for services oriented companies. So yeah, there's a lot of like things that feel like, oh, that should be easy or it should be done. But like, it actually takes more time to get a BAA signed with all those requirements than it does to hire someone and build it.
Yeah. So another essential part of healthcare products, specifically mental health, is measuring how efficient the treatment is. And sometimes it's even more difficult to measure efficiency when we're dealing with mental health. So how can we measure the patient's progress during treatment? Can we use technology to make it more objective?
Yeah, I can take this one. You know, we at Cerebral, like, you know, this is sort of like our bread and butter. Like there are, you know, specific assessments that we have our clients take on a monthly basis. You know, the PHQ-9 is an example, and, you know, folks take it, and then we're able to, you know, pass those results on to the clinician. They're able to talk to the clinician about it, but then they're also able to like come back and see the progress in their app and, you know, how they're progressing over the course of their treatment. So I think that that's really interesting. But there's a lot out there. I mean, I've seen mood trackers and journaling and, you know, all kinds of things that are like using machine learning to, you know, showcase back results to folks, which, you know, I think is, you know, sort of new and innovative in the healthcare space.
I can add there a little bit that it's also in a way a trade-off, because the more accessible and the more affordable that we want to provide the services for underserved populations or uninsured populations, then it's very difficult to add the biomarkers, for example, or a different gadget to actually measure, like a Fitbit or even a watch or even a breathalyzer. So the more we want to be more specific and more accurate in measuring the progress with different kind of gadgets, the more expensive it becomes. So the less amount of people can get access to, because again, we go back to the problem Philippe mentioned, right? Like, who is going to pay for it? So it's a very kind of trading off situation, as, okay, we do work on self-subjective assessments that are clinically validated instruments for specific countries or whatnot, but then we cannot go for the bio kind of data, right? So it's tricky to know how to design it, and depending on who your patient population is going to be also.
I may add
Right.
something there.
Sure.
That is my pet peeve. So I actually, I'm a you know, big proponent of the measurement, and that is you know, because the reason that we are stuck in the last 70 years, in my opinion, is the lack of measurement. The basis of health and medicine is what we call the evidence-based practices, meaning that you measure something, you evaluate it, you reevaluate whether what you measured changed, and change what you're doing. The biggest challenge that we have, for instance, right now, in depression, the efficacy of many of the medications for depression at best is around 50%. The challenge is that it's not that that medication doesn't work. There is that most probably we are bulking a lot of patients with different you know, symptoms and diseases, and are trying to address all of them with the same medication. For instance, when we talk about depression, depression is not a disease. Depression is a you know, a compilation of symptoms which has multiple underlying causes. Addressing depression is similar to saying, I want to treat coughing, right? Coughing, you know, could have multiple causes. It could be because of allergy. It could be because of COPD. It could be because of cancer, or it could be because of GI reflux, right? So you can come up with a medication that actually can, you know, suit the coughing, but the only way that you can treat the coughing is to treat the underlying cause. And for this should be the case for instance, all mental health problems as well. We cannot put multiple, like 5 different you know, pathophysiology under the same name and try to address all with the same medication. In my opinion, the only way we can move past where we are and where we have been over the last 7 years is to implement very you know, careful measurements that can separate them. But I do agree, but not all, kind of measurements should be technology heavy. And that is why, for instance, we are using natural language processing. That is the main source of information that the clinicians use for diagnosing the patient's problem and, coming up with the treatment. And really, we can have sources that can do that in a really scalable and, low cost. So I definitely think of the measurement to be should be in the forefront.
And Mohsen, how can we get to the root of mental health conditions in order to treat them more efficiently?
I believe the challenge is that we can. There has been this approach to go to the brain. The brain is too complicated. I'm saying this, I'm a medical doctor. I did a PhD in neuroscience with the idea to solve the brain. I became disillusioned in my postdoc that we are not going to solve the brain anytime soon. But we could still do measurement based, right? We can, instead of, calling everything depression, we can try to break it down into different buckets. This depression patients, this is how their appetite changed. This is how the level of their anxiety. This is how their sleep changed. And you will see that, there are probably 10 different buckets. And we will find that, the medication works for bucket 1 and not for bucket 3. And psychotherapy works for bucket 4 and not bucket 6. So the real thing is we have to collect, focus on measuring and focusing on the outcomes, and we have to collect a big data. The challenge is that it's a complicated situation. Nobody is going to solve it alone. And the only way is for us to be able to combine different technologies and to combine different data sources and to combine the outcomes to be able to, do this dissection and come up with the best solution.
So adding more granularity to the conditions in order to have a more personalized treatment for each patient.
Exactly.
Awesome. Thanks. Okay, so we're ready to start with the third module, which is scaling mental health products. And the first question is, I know many startups start with the B2C model, but the main problem is that customer acquisition is way slower unless you spend millions of dollars on marketing. There's an alternative, which is B2B2C, which requires health plans or employers to cover your service, but it is not always that easy to get. And I personally know many health tech founders who are struggling to get coverage by health plans on their products. I know that both ReKlame and Cerebral have insurance coverage. What advice can you give founders who are struggling to get this?
Yeah, so this is not easy either. The B2C model is hard, but this one is also hard. I mean, it's definitely another pathway forward. But I would say the first thing to do is, at least understand the differences between the various types of health insurance, right? You have Medicaid, you have Medicare Advantage, you have commercial, all different kinds. And so understanding those, and then understanding like your target audience and like why you would target, one of those particular types of health insurance. So I would start there. The other thing I would do is, make sure that you're finding the decision maker. In most cases, it's probably the CEO, but or like someone on the executive team, but making sure that you're, getting an in that way. Someone on this call mentioned, data and security, but that is a very important factor. So making sure you're dotting your I's and crossing your T's when it comes to making sure that you're compliant there. Another idea too is direct to employer. So and actually I think is probably a little bit easier, like if you have a product offering that employees are really interested in. Sometimes that's an easier way to get employers to pay for that service out of pocket. So you kind of cut out the middleman there. So that's an idea too.
Evans, any advice?
Yeah, I'm happy to add. Building off that, collecting data from day number one is extremely important, and because data compiles, and the longer you have data, the better. And collecting data could just be a series of cohort studies on day number one. So it's really important because data will ultimately be how you will paint your picture. But really, my advice would be really getting a deep understanding of the healthcare system and behavioral health, especially when it comes to insurance. It's very complex with the regulation impact, and things are always changing. So it's good to just understand the depth and the complexities of it. Collecting the data from day number one, and as you get more and more users or patients, then you have enough to present a case to the insurance. And it could be, you could present a case for to get an entire product coverage, or sometimes we present cases to get just one person covered. But really the data and being able to present and finding the champion decision makers to then move through the stakeholder landscape, it would be my best advice. But yeah, it's all about getting started. So if you can collect data and you're getting started with B2C, so then you have customers, you're putting yourself on a path to be in the best position.
Yeah, so it seems like data is a crucial aspect for every healthcare product in many different dimensions. So another common challenge of healthcare platforms is being able to provide a great service and patient proximity, while at the same time optimizing the most expensive resources, such as providers. In other words, this is a scaling problem. How can we offer patients continuous care while remaining profitable?
I'm happy to take a stab.
Sure. Want to take
the main thing is this is one thing I'm really passionate about because I'm a clinician by training, but having providers practice top of the license. So really, if we thought about if we thought about a provider team, like the MD, RN, care navigator, medical assistant, so every single task being tasked to the right person. So our providers aren't doing disability paperwork, they aren't doing things that are taken away from the decision making. So that is really important, keeping costs down. And now with the beauty of advances in technology, being able to leverage AI and different models to help automate certain processes around claims, payments, back office, front office, the digital health front door can really help keep costs down. Really, when we think of services, what separates services from tech enabled is if we can eventually get to a point where the cogs just flatline. So I really believe that leveraging the beauty and the advances of technology and having providers practice top of license is probably the two biggest ones that we have been leveraging.
Alex, do you want to add anything?
Yeah, I'll add a couple on the product side, for scaling. But one, we talked a lot about looking at the data, and I do think that is important as you start to think about how to set up your clients or your patients for success at a company that's large and services many folks. We noticed in our data that, folks who came in and got off to a really strong start, meaning that they had 3 therapy sessions in their first month, were more likely to see success on the plan. And so, I now have a growth hacking team, who is fully dedicated to getting people to their first 3 sessions, using things like push notifications and emails and reminders and different things like that. So, taking a look at the data to find out where you have opportunity, and focusing there. The second thing, which I think Evans, talked a little bit about already is, making sure that your providers have tools, but also like making sure that your clients have tools of like finding out like, okay, where is my medication, or like how it, like, am I scheduled or not for my appointment? Like making sure that, they have everything they need, so they don't have to contact customer support to find out, where something might be, or tracking or shipping information, for example. And then the third, I think, is like making sure, depending on the size of your company, that you have the right amount of like W-2 employees versus 1099 employees. And I think that that's important because there will always be things that, that happen aside from just like servicing clients. Like you might need, therapists to join focus groups, or to provide feedback, or to do other things like that, or provide webinars, or other things that, actually end up being a full-time job, but like at a certain point, like you don't need as many of them. And so changing the payment model of how you pay folks, I think, is another thing to look at, and making sure that like your ratios are correct.
Thanks. Let's do one more question before jumping to the Q&A. This is going to be a bit of a philosophical question. So it's true that in every marketing, or even in product decisions, we often leverage the human psychology to build habit-forming products. There's a famous book called Hooked by Nir Eyal, which is the Bible in this field. And he also happens to be an advisor in MindCo. So the question is, if we can use these tricks to make patients engage more and thus adhere better to treatment, we're doing it with a good purpose. But where is the ethical boundary for this?
Well, I will jump in there because I did have these kind of conversations. I think that you said the key word here, that is purpose. Sometimes these kind of habit formation techniques that can be used for other kind of products, and we take social media apps, for example, that invented kind of the light for us to be hooked into the flow again, or these kind of things. They don't have a purpose of making us, or making the life of people better, right? And this is improving lifestyle, improving access to a better lifestyle, to like a self-empowerment kind of tools. So I think that the ethical boundary is, of course, on us, on the founders, on the people who design these kind of products. And it is our job to really understand the needs of our patients, our users, and who is going to be using our products, because then the hook, we know that is going to be a good one, right? Like we really are pursuing, like what just Alex mentioned, right? Like this growth hacking team to make people go back to therapy, or use the product because she knows that this actually is a good thing. So I think that this is those kind of examples that all of us here, we are pushing the boundaries of technology for good, right? And I think that's something that is very nice in this industry. We are not becoming an entertainment marketing kind of app with the boundaries aren't so clear. AI probably is a different thing, but when we design habit formations apps, I think that definitely understanding the patient is very important, to understand when we can actually, or how we can leverage these kind of triggers, both internally, externally, and everything that is related to these kind of theories, to make them back, right? So to their own path to improving their lives.
Thanks, Emilio. If anybody else wants to add anything to this, otherwise we can jump to the Q&A.
A very quick comment on Emilio. I'm with you on that. My experience in the behavioral change and motivation and incentives is a nightmare. The marketing tricks work in consumer because they leverage the natural need and Maslow kind of pyramid thing. In healthcare, I've not been able to get, from many different angles, traction, some little traction, but not Facebook scale traction. So the only one, unfortunately, I see is financial incentives, micro, task-based micro financing incentives. But yeah, this for anyone's getting in the industry, can't just use the same tricks to hook people in Facebook and believing it's going to work in healthcare. It's just don't. And Emilio, I think I just salute you for all the effort you're doing in using VR to create experiences that may have traction.
Thank you, Philippe. We have 4 minutes left, so let's jump to the Q&A. So do you, can the speakers see the questions people asked through the chat?
Yes.
No?
Yep.
Yes.
Yeah, okay. So feel free to pick one and answer it right away. They're too long for me to read them out loud. So if you choose one, just click on the answer live next to it. I think it will show it for everyone. Then you can answer.
I just click one. I don't know if everybody can see it. But Michael is asking something about the human-to-human connections and how the tools that we are working on can actually increase the efficacy, but also without neglecting the human-to-human connection. And I go back to the trade-off. Mohsen was talking about, here we have AI, we have telehealth, and we have virtual reality. So at the end of the day, and this is my opinion, we all aim to enhance the one-on-one intervention. It's impossible to replace the contact of a hug, with any technology. So yes, the idea is, imagine that we all have access to one-on-one interventions. It means that we are all privileged people. Many people don't have access to one-on-one. So I think that technology brings forth that opportunity to close the gap and get us closer to that, as somebody said at the start of this panel.
Thanks, Emilio. I think we have time for one more question, maybe.
I saw a question about for collaborative efforts between doctors, patients, and other stakeholders. So that's actually something we offer kind of as a service. So some of the things that it's interesting. Like, we do a lot of requesting medical records, bringing that in, making that understandable to the providers that we employ, and then packaging that information back and both sending it to external providers. So again, we're a wraparound service. We don't own primary care. We will send our findings to the person's primary care provider, to their BH provider, and their pharmacy sometimes as well, and try to package that information about their medical care and their behavioral health back in terms that are easy for the other providers to understand and pick back up on where we've left off. We will send that information with our patients. We'll send it with the peer. Sometimes they'll attend appointments. And so a lot of the collaborative opportunity here is actually making dense amounts of information understandable and easy to, and then also kind of sharing it across as many surfaces as possible. So we'll send them faxes, we'll send them emails, we'll send like physical copies of paper with our patients. And ultimately, it's like for really complex individuals who might have multiple chronic conditions, multiple mental health conditions, making sure all of their providers are actually on the same page is one of the hardest things. So it's less about the technical challenge of taking a bunch of codes and more about the challenge of how you get it in front of people. Are you doing it consistently, and are you doing it in a way that's actually legible to the provider? So if you send them a 15-page document, they're not going to be able to understand that. How do you summarize that into a one-page thing that a provider can look at in 1 minute before the appointment starts? And we've seen a lot more success in actually getting continuity of care set up. But it's relatively manual. It's more about the effort of actually putting in the time to do it and thinking about the providers.
Thank you, Shohini. Okay, so this is the end. Thanks everyone for joining. Thank you to all the speakers for joining us in our first edition. Stay tuned, because there are going to be more editions of this roundtable, and we're going to send you a short survey after this. So please, if you can fill it out, it's super helpful for us to improve these events. So thanks again, and see you in the next one.
Thank
Thanks,
you.
Alan.
Thank you.